Hello, welcome to another edition of the Eye Associates Sight for Life and so much more. I'm Jill Graw, Patient Care Coordinator at the Eye Associates. The Eye Associates specializes in restoring and improving sight. We take great pride in our vast knowledge, educational standards, and quality patient care. I'm proud to say that we've been repeatedly chosen as best ophthalmologists, best optometrists, and best eyewear by our community. Today, we will be talking about the latest vision correction technology for those that want to get out of glasses, LASIK and clear lens replacement surgery. We do these shows so that we can spend the time needed to educate you on how to keep your eyes healthy and seeing your best. We know that good vision means safer and a more enjoyable life. Here to explain your options for LASIK and clear lens replacement are two of the most skilled and well-respected eye surgeons in the area, Dr. Kathleen McCabe and Dr. Brian Foster. Thank you, doctors, for being with us, and welcome. Dr. McCabe, I know that you're a board-certified ophthalmologist and surgeon, and I know that you've been named to both the Laser Vision 100 and Premier Surgeon 250 lists. Very impressive. So welcome. Tell the audience a little bit about yourself.
Well, thank you for having me, Jill, and it's exciting to be here talking about this subject, something that we're really excited about.
Yes.
I actually did my medical school training at Medical College of Wisconsin. I spent 10 years in private practice in Indiana, where I was in a very busy surgical practice and LASIK practice. And from there, I joined the Eye Associates. I did my medical training in Wisconsin, but I did my residency at Bascom Palmer Eye Institute in Miami. So coming back to Florida to join the Eye Associates was really exciting for my family and I.
Dr. Brian Foster, I know that you're a board-certified ophthalmologist and fellowship-trained cornea specialist. Tell us a little bit about yourself.
Yeah, and I'm also very excited to be here. We'll have some good discussion tonight. I actually grew up in Florida, and so did my wife, and went to University of Florida and on to Emory University for my medical training, and then up to Wake Forest University for my ophthalmology residency. I did an extra year of specialty training in cornea subspecialty in Atlanta, and my family and I are very excited to be a part of this area and providing care for the community here.
Well, welcome. Dr. McCabe, let's start off talking about LASIK. I think most people have heard about LASIK, but please tell us, what is LASIK?
Well, LASIK is a way of using a cold laser to reshape the surface of the eye in order to put your glasses prescription on the eye, basically, in a way that allows you to be glasses-free. So it's a very predictable, precise, easy, painless, and a wonderful procedure, really, that allows a new independence from glasses and contact lenses for patients.
Well, Dr. Foster, do you use the same laser with LASIK that you use for the bladeless cataract surgery?
No, and it's actually a different laser. The laser that we use for LASIK is a sculpting type of laser, and that laser reshapes the cornea to give vision. The laser that we use for cataract surgery actually does a lot of the specific steps for cataract surgery. So it's a great question. They're both very precise instruments, but they are different.
Now, Dr. McCabe, what is the difference between traditional LASIK and custom LASIK?
Well, in traditional LASIK, we took your far vision prescription, so if you were nearsighted or farsighted, or if you had astigmatism, and we just basically put your glasses prescription programmed into the laser. With customized LASIK, what we're able to do is take a very precise image of the optical system as the light passes through your eye, so that that treatment not only is for your glasses prescription, but it's very specifically for the shape of your eye to give you the best quality of vision after the LASIK procedure.
Well, Dr. Foster, who is the best candidate for LASIK?
Yeah, and there are actually, the great thing about the procedure is there's a wide range of good candidates. I can think of a patient that I was really happy to get seen very well, and it was a gentleman that was actually a 24-hour race car driver, and I can't imagine the intensity of driving a car for that long and during night, during day. But he was basically wearing his contact lenses for the entire race, and really having a lot of difficulty seeing well because of that. We did a LASIK. He was actually fairly nearsighted, and he was 20/20 afterward and very excited about the prospect of seeing well to race without having to deal with his glasses or contact lenses.
You know, I bet
So-
you don't blink very frequently when you're a race car
I
driver.
bet you
so-
don't. I know I wouldn't.
Yeah,
I
those
know.
contact lenses are probably harder in that
Yeah.
situation.
You probably feel safer.
Yeah,
Yeah.
exactly.
Dr. McCabe, are there people that are not good candidates for LASIK?
Well, there are, and probably the most important part of your entire LASIK experience is that LASIK evaluation, because there are some patients that really would be benefited by other procedures than LASIK. Not that they couldn't be glasses free, but that a corneal thinning procedure like LASIK might not be the best choice. And so we do go through a very, very precise and thorough evaluation of the optical system of the eye, the shape of the cornea, the thickness of the cornea, really to determine if LASIK is the right choice and if it's going to meet the expectations of the patient. So sometimes a patient is past the age of needing reading glasses, and we really know that LASIK isn't going to be able to give them both distance and near vision. So we talk about other options at that time, and we'll have a chance to talk about that, I think, tonight as well.
Absolutely. Now, Dr. Foster, for a patient that is not a good candidate for LASIK, would they be a candidate for PRK? And can you explain to our audience what is PRK?
Exactly. And PRK is actually very similar to LASIK, except you're really sculpting the very superficial surface of the cornea instead of making a flap. So there are some patients, you know, for instance, NBA basketball players, or some patients that professionally are at risk, you know, for eye trauma on a very regular basis that may choose to do something like PRK as opposed to LASIK. They're both very safe and they're both very effective, but that's one of the instances where PRK may make more sense. Other patients, actually, like Dr. McCabe was mentioning, have certain anatomy that may make LASIK not as good a choice as PRK. For instance, if the cornea may be a little more thin, that can possibly be another advantage of PRK.
Well, Dr. Foster, are there other options for patients that are too nearsighted to have LASIK?
There are actually, and this is an exciting field, and there are a lot of different technologies that the FDA is looking at to really address that exact question. There are a few FDA-approved treatments for patients that are highly nearsighted. One of those is implantable contact lenses, and that's a technology that is quite reliable in providing patients that really LASIK or PRK is just not an option because they have so much nearsightedness, and giving those patients basically their life back because they're not dependent on hard contact lenses or really thick glasses, and that's a really nice thing to be a part of. There are also some other technologies the FDA is looking at to actually give folks, believe it or not, some implantable devices in the cornea itself to provide patients reading vision where they may not be able to achieve that otherwise. And so those are things that we're really excited about, and some of those are still on the horizon.
Another thing that can sometimes help in that case too, though, is a clear lens replacement, where we take out the natural lens before a cataract is formed and put an artificial lens implant in the place of the cataract. And so I think we're going to have a chance to talk about that a little bit more, but that would be in that same range of things that can help patients who are a little bit too nearsighted or a little bit too farsighted.
Okay, well, a friend of mine, Dr. McCabe, has astigmatism. And can he still have LASIK with an astigmatism? And can you explain what is astigmatism?
Yeah, a lot of patients know that they've heard that word, astigmatism. I'm not sure what it is. What it is the curvature of the cornea. So that clear window in the front of the eye, the cornea, is more steeply curved in one direction than another. And the effect of that is to cause some blur at distance and at near, really, with astigmatism, if it's not corrected. It is corrected in your glasses, and that is one way to approach it. But a better way of correcting your astigmatism is actually either on the eye with LASIK or in the eye with an astigmatism correcting device, like an implant.
Okay. Well, now, Dr. Foster, someone told me that you actually had LASIK yourself. So you can speak from firsthand experience. Tell us a little bit from a patient's point of view what it's like to have LASIK.
Exactly, and I actually decided to have the procedure in my residency training program because I was seeing just the many happy patients after LASIK, sitting up from the bed and reading the clock where they weren't able to before. And going through that process of learning about LASIK and working very long hours where I was actually a contact lens abuser, which I'm sure a lot of our listeners could probably raise their hand and admit to that. But basically putting my eyes at risk from infections and significant dryness because of overwear of contact lenses, I made the decision to go ahead with LASIK, and I'm very happy I did. I have very good vision. I don't have to worry about risking my eyesight with contact lens overwear, and so it's a really wonderful procedure to be able to provide to my patients because I know the benefits that I experience from it. But as far as the procedure itself, it's actually quite short. It's a quick procedure, eye drops for anesthesia, no pain, basically just seeing some light while you're on the bed, and it's over before you know it. It's really quick.
It's exciting. Dr. McCabe, after LASIK or PRK, will I ever have to wear corrective lenses again?
Well, unfortunately, although we can correct your distance vision, we can't make you 20 again. And everybody eventually gets to that point where their arms become a little bit too short and it's difficult to see up close. And that happens sometime in our 40s. And that still happens if you've had LASIK, because nothing about the LASIK procedure has affected the aging process of the lens in the eye. And that's what causes that decrease in reading vision. So for that reason, you'll still need reading glasses. And as a cataract forms later in life, which happens to everybody, there is a change in your prescription, and sometimes that also will put you back in glasses for a short period of time.
Well, Dr. Foster, one of my neighbors had LASIK after having cataract surgery. What is that about?
Yeah, and that's something that fortunately does not come up very often, but it is an important point because a lot of our patients maybe had cataract surgery several years ago, or in rare cases, even with modern cataract surgery technology, they may still have a little bit of nearsightedness, or their vision isn't quite as sharp as we could achieve with LASIK. And so even after cataract surgery, it is a very safe way to fine-tune the vision to really get patients exactly where they want to be with their vision without glasses. And so that's something that I definitely encourage anybody listening. If you had cataract surgery a while ago and really aren't happy with how you're seeing, it's always definitely worth the time to spend in an evaluation just to look at that and see if that's something we could potentially sharpen for you.
And Dr. McCabe, is LASIK covered by insurance?
Well, LASIK is considered to be a cosmetic procedure. It's an elective procedure in order to keep you free from your glasses, and that is not covered by insurance. We do have financing available that allows those payments to be broken up into very affordable, interest-free payments. So there are options, but it is not covered by insurance.
And Dr. Foster, how long will I be out of work after having LASIK?
It's a very quick recovery. It depends on what line of work, but in general, within a day or two, I'm advising my patients that they can get back to work. We do a few steps after LASIK surgery, including some eye drops and a protective covering on the eye just to prevent eye rubbing for a couple days. But it is a very quick recovery and a very fast improvement in the vision, so it's a nice thing.
And Dr. McCabe, if someone's interested in LASIK, what should they do first?
Well, the best thing to do is give us a call. We do have free LASIK screenings where you'll come in and we'll do some of the essential measurements that let us know whether or not you're a candidate.
Okay. Well, listen to what one of our LASIK patients has to say.
Before I had the LASIK surgery, I was, it was a lot of contacts, a lot of glasses, and I was nearsighted, so I couldn't see far distances. I play a lot of sports, I'm very active, and it was just a struggle, sweat in the eyes, and fogged up glasses, and just not very fun, always changing, and I'm not good with touching the eye at all, so that was a big problem, a big issue for me. I did a lot of research, and I hopped online and looked up, LASIK surgery in the area. And I think the main reason I chose the Eye Associates was, I got good feedback when I reached out and spoke with them, great customer service, as well as a lot of different reviews had nothing but good things to say. So I thought it was a good fit. I had Dr. McCabe. She was just very friendly, talked me through the process the whole way, the surgery in its entirety, and it was great. I mean, she was phenomenal. The actual surgery itself was, pretty quick and easy. I was surprised that I was in and out in, I'd say maybe, less than a half hour. So it was a great experience.
Well, now let's talk about a new vision correction procedure, clear lens replacement, or CLR. Dr. Foster, I think that clear lens replacement is also referred to as refractive lens exchange. But can you tell our audience, what is a clear lens replacement surgery?
Yeah, the bottom line, Jill, is it's basically cataract surgery before you develop a visually significant cataract. And so a lot of the advantages that we can provide our cataract patients in some of our advanced technology lenses, some of the lenses that correct a lot of astigmatism or correct, vision for very high quality distance vision and reading vision without glasses. A lot of our patients over 40 that are really having trouble with their vision can benefit from these same lenses. And so we're actually able to provide a very similar surgery in those patients and provide a very high quality level of vision to those patients as well.
And Dr. McCabe, is clear lens replacement done with the same bladeless laser as you use for cataract surgery?
Yes, in fact, in patients who have no cataract, see really wonderfully with their glasses or contact lenses, anything we can do to increase the level of precision and our accuracy and outcomes is something that we would definitely want to employ for those patients. So bladeless laser cataract surgery is a great advancement, especially for these patients.
Now, Dr. McCabe, can you tell us more about the high-tech implants and what their benefits are?
Sure. The high-tech implants involve pretty much two categories. We have implants that will correct for astigmatism, and especially high levels of astigmatism, that allow patients to see at distance very, very well without their glasses. And we have lenses, advanced technology lenses, that give a full range of vision, distance, intermediate, and near vision without glasses. And that's really a wonderful thing. In fact, in a lot of ways, it helps our patients with safety. I've had a lot of patients who say, with their bifocal or their progressives, they have to position their head in such a way that if they're looking down and say they're going downstairs or trying to maneuver around objects and curbs, they really feel unsafe because they can't judge that distance very well, where it's foggy through the part of the vision or their glasses that is really required for near vision. The nice thing about multifocal lenses, the advanced technology lenses, is that you don't have to position your head any particular way in order to see that full range of vision. Everything is in focus at the same time. And so if a patient's looking down with those lenses, they can see their food up close, or if they're walking downstairs, they can see the stairs and maneuver if they need to.
Now, Dr. Foster, does the patient make the choice as to which implants they get?
It's really a partnership, Jill, between the doctor and the patient. And we have a lot of great information that's available to us, and obviously it's important for us to convey our experience to the patient. But it is a team effort, and it's a conversation between Dr. McCabe and myself and our patients. What do you want out of your cataract procedure or your clear lens replacement? What are your goals? And so knowing the goals, knowing the patient's anatomy and the characteristics of their eye, we kind of come to an agreement about what we feel is best for them.
So when you choose a lens, one type over another, it's with the patient's conversation and their lifestyle.
Very important, very important.
Okay.
Really customized to the patient, what their needs are, what the anatomy of the eye is, the health of their eye is, and they ask questions and we together make that decision.
Yeah.
Well, Dr. McCabe, what would be the advantage of having a clear lens replacement over LASIK?
Well, clear lens replacement will give you that full range of vision with a multifocal lens that allows you to have that for the rest of your life, really a very stable situation. If you have LASIK, you will still at some point need reading glasses, either immediately if you're of the appropriate age, or as you age if you're a younger patient. And the other thing is you will eventually develop a cataract if you've had LASIK. And at that time, you'll need to decide on what you're going to do in order to see that full range of vision again, and some of your choices may be limited at that time. But if we do a clear lens replacement, you will never develop a cataract. It will be a permanent solution, and that will be very, very stable.
I think you had a professional golfer that you did a clear lens replacement on, and he was happy.
I did. I had a recent patient who is a pro golfer, and he was really, getting to the point where he was frustrated with his contact lenses. He was of that magic age where he couldn't see up close to record his score, and he wanted to do something, he thought LASIK, to get him out of his glasses and contact lenses permanently. And after much discussion, we talked about what the options were. He chose a clear lens replacement with a multifocal lens, and now he can see distance for his drives, he can putt at the intermediate distance, and he can record his score and do all those things without glasses or contact lenses. In fact, even the same week as his surgery, he went on to do a tournament and was in one of the top award-winning teams at that time.
So Tony, you're just out from surgery.
Yeah.
And what do you think about clear lens extraction?
Well, I can't wait to walk outside and be able to see something without knowing I don't have a contact lens or glasses on. I'm excited. Very excited.
Well, everything went very smoothly during your surgery.
Okay.
Were you comfortable?
Very much so, yeah. Very relaxed.
And was the staff here at the Eye Associates able to keep you nice and relaxed? And did you feel very comfortable with what was going to happen? Like you knew what was
Yeah, I
coming up?
mean, everybody's explained over and over again what we were doing and knew exactly what we were in. Just, I've never done it before, so you're always wondering what's going to happen. But no, I was very aware of everything.
Are you able to see anything yet with that eye?
Yeah. Yeah, I feel like I have my contact lens back in that eye.
Yeah.
So, but I know that it's not there. So, yeah.
That's pretty exciting,
Yeah,
isn't it?
very exciting.
Yeah.
Oh, yeah.
Really,
Yeah.
it's
From being as young as I can remember, not being able to see,
Yeah.
just not even, littlest things. Your alarm clock, you have the old alarm clock. But I'm born and raised that way, so no, I'm very excited.
yeah.
Very excited.
Yeah, it's pretty neat that this surgery you really can see right away. So which is your good eye now?
The right.
Right after surgery. That's pretty
Yeah,
cool,
it's
huh?
pretty phenomenal.
Yeah.
I can see everybody over there. Yeah, no, I'm excited. Yeah, I'm very excited. Thank you so much.
You're so welcome.
Yeah.
It's our pleasure.
I'm glad you did it.
So yeah, everything went very, very smoothly. You're
Reading
gonna be
about
very,
you.
very happy.
I'm glad you did it.
Well, thank you. We were happy to do it too.
Yeah. Thanks.
Now, Dr. McCabe, are there other important considerations for this procedure?
There are always important considerations of the anatomy of the eye and the needs of the patient. So it is important for the patient to come in and have a full examination that looks at what some of those needs and what the condition and health of the eye are.
Now, also, Dr. McCabe, if somebody's already had LASIK, can they have a clear lens replacement so they can have the distance and near vision?
Yes, patients who have had LASIK in the past are often those patients who are most motivated to try to be free from their glasses. And they may have had LASIK in their 20s, they've now reached their 40s, they're back in their glasses, they're very frustrated, and they really want to see if there's a solution that makes everything better at all different distances. And for those patients, this is an option. And we would do a little bit of more in-depth analysis of what kinds of changes have occurred from their LASIK in order to see what the best choice is. But we would have options and we would discuss those with the patient.
Mm-hmm.
Now, Dr. Foster, if a patient has an astigmatism, can they have a clear lens replacement?
They can actually, and there are several different ways to approach and treat astigmatism. And it really depends on the severity of the astigmatism, but it is a very reliable way to treat it. And those are some of my happiest patients that have lived their entire lives with a lot of astigmatism, even as a kid, just remembering never going out to play without glasses on, and taking that away and really giving them very useful vision without glasses is really fun, really exciting.
So, Dr. McCabe, I think the other day you were telling me a story about a patient that had a clear lens replacement and felt safer. Tell me a little bit more about that patient.
Well, I have had several patients recently where really they were having more difficulty because of their maneuvering around, and they really felt like there's two really big categories. One is, the fact that sometimes whatever they're doing, sports especially that's outside and in the rain, and they're really not able to function well with their glasses. And the second are the patients that I mentioned earlier, where they're really having difficulty with a bifocal or a progressive. and they're looking down through that and really don't know how to maneuver when they have that progressive or bifocal on.
And is clear lens replacement covered by insurance?
Clear lens replacement is not covered by insurance. That is something that is considered to be a cosmetic procedure, something that allows you to be glasses free. And although it's not covered by insurance, we do have very affordable financing that we can break that up into interest-free payments and make it easier for patients.
And Dr. Foster, where do you do the clear lens replacement surgery?
Yep, we have. We're really lucky to have a fantastic ambulatory surgery center as a part of our office, and it's a AAA HC accredited, Medicare approved surgery center, and it's basically a facility that provides us fantastic staff, all the technology we need to provide very high quality surgery. Our bladeless cataract laser is there, and it's just generally a wonderful experience for our patients to go and meet our staff and have a procedure. And a lot of people go in nervous and come out just very happy with, you know, their experience there.
And you know, all we do there are eyes, so we're really, all of the staff and everybody else are just expert at doing this one particular thing very, very well.
Yeah.
And do you do clear lens replacement on both eyes the same day, Dr. Foster?
Generally, industry standard is actually doing those on different days, and so that's what we do, and that's very standard throughout the country. Sure.
And tell me, if a person is interested in clear lens replacement, what should the first step be for the patient to do, Dr. Foster?
Yep, and basically an eye examination with us, where we do a lot of careful measurements of the eye, carefully check the vision. Cataract evaluation or a clear lens replacement evaluation is one of the most thorough eye exams you can possibly have, and so that's something that helps us make a determination as to what would be best, you know, for the patient.
And Dr. McCabe, why should a patient choose the Eye Associates?
You know, at the Eye Associates, we have a very dedicated staff that are wonderfully experienced, have been there for a very long time. Patients routinely come to me afterward and say what a wonderful experience it was, how warm and caring the environment is, and they really feel special and cared for as individuals. And that's really what we're all about, customizing the experience and our results to the individual. So I can't think of a better place to come, really.
It's a big family.
Good. Well, and I also know that the Eye Associates has full service eye care, optical, hearing, cosmetic procedures, and even dermatology. But unfortunately, we are out of time. Thank you, Dr. McCabe. Thank you, Dr. Foster. And thank you, audience, for joining us today. If you have questions or if you'd like to make an appointment with one of our award-winning doctors, we'd love to see you. Just call the toll-free number 1-866-865-2020. Our goal is to keep you seeing your best and enjoying your life. So for now, I wish you the best sight for life and so much more.